Ever wondered if there are hidden dangers lurking in your daily routine? Factors that could unexpectedly turn deadly after 70? As we age, our bodies become more vulnerable to certain health risks that don't always come with obvious warning signs. Many people believe that sudden death is just an unfortunate, unpredictable event. But the truth is, there are specific triggers that significantly increase the likelihood of life-threatening emergencies. And the worst part? Most of them are often ignored until it's too late. In this video, we're uncovering 5 sudden death triggers that can catch people off guard after 70. These aren't just random health concerns. They're silent killers that strike when least expected. From unnoticed heart conditions to seemingly harmless everyday habits, each of these triggers can have devastating consequences if left unchecked. But here's the good news: once you know what they are, you can take steps to protect yourself and reduce your risk. Stay with me until the end, because understanding these 5 triggers could mean the difference between living well into your golden years or facing an avoidable health crisis. By the time we're done, you'll have a clear understanding of what to watch out for and, more importantly, how to safeguard yourself against these risks. Now let's dive in. Number 1, silent heart attacks. One of the most dangerous health risks after 70 is a heart attack. That happens without you even realizing it. Unlike the dramatic scenes you see in movies, where someone clutches their chest and collapses, silent heart attacks don't always come with obvious warning signs. Instead, they creep in quietly, often mistaken for indigestion, fatigue, or a mild case of the flu. The problem is, because the symptoms are so subtle, many people never seek medical attention, allowing the damage to their heart to go unnoticed until it's too late. Imagine a man like Richard, a 74-year-old who still enjoys his morning walks and occasional rounds of golf. A few months ago, he felt unusually tired, a bit short of breath, and had a slight discomfort in his upper back. He chalked it up to poor sleep and brushed it off. What Richard didn't know was that he had just suffered a silent heart attack. He never experienced the crushing chest pain most people associate with heart attacks, so he assumed it was nothing serious. But weeks later, his heart had already suffered significant damage, putting him at a much higher risk of sudden cardiac arrest. Silent heart attacks occur when blood flow to the heart is blocked, but the symptoms don't present in an obvious way. Instead of sharp pain, you might feel discomfort in your jaw, neck, or even your upper stomach. You might feel slightly dizzy, unusually tired, or experience nausea. Some people mistake it for heartburn, muscle strain, or even anxiety. But the reality is, even if you don't feel severe pain, your heart is still being deprived of oxygen, and that damage can build up over time. The real danger comes when a second, more severe heart attack strikes. If your heart has already been weakened by a previous silent attack, your chances of surviving another one drop significantly. Many people only discover they had a heart attack when they go in for a routine checkup, or worse, after they collapse unexpectedly. And that's why awareness is so crucial. If you ever experience unexplained fatigue, shortness of breath, or discomfort in your upper body, that doesn't feel normal. Don't dismiss it. Get it checked out. A simple electrocardiogram, EKG, or a blood test can reveal if your heart has suffered silent damage. Prevention is key, and recognizing the warning signs, even when they don't seem urgent, can be the difference between life and death. Number 2, postural hypotension and falls. A sudden drop in blood pressure when standing up might not sound like a big deal, but after 70, it can be deadly. This condition, known as postural hypotension, causes dizziness, lightheadedness, and even fainting. For younger people, a brief dizzy spell might be nothing more than a minor annoyance. But for seniors, it's a leading cause of dangerous falls. Falls that can result in fatal head injuries or hip fractures. What makes this so alarming is that most people don't recognize it as a serious issue until they've already fallen. Take someone like George, a 78-year-old, who still enjoys his morning coffee at the local diner. One afternoon, he stood up too quickly from his chair and suddenly felt the room spin. He reached out to steady himself, but before he knew it, he had lost his balance and hit the floor. The fall left him with a fractured hip, and while he thought recovery would be straightforward, complications set in. He spent weeks in the hospital battling infections, and what started as a simple, dizzy spell turned into a life-threatening ordeal. Falls are one of the biggest health risks for seniors, not just because of the immediate injury, but because they often lead to a downward spiral in overall health. A hip fracture can mean months of immobility, which weakens the body, increases the risk of blood clots, and makes infections more likely. Many seniors who suffer a major fall never regain their full independence. Even if they survive the initial injury, the complications that follow can be devastating. So why does postural hypotension happen more frequently with age? As we get older, our bodies take longer to adjust blood pressure. When we go from sitting or lying down to standing, the heart may not pump blood as efficiently, and dehydration, medications, or underlying health conditions can make it even worse. That's why some seniors feel perfectly fine when seated, but get lightheaded the moment they stand. The worst part? It can happen without warning, and once a fall occurs, it can set off a chain reaction of health issues that are difficult to recover from. If you've ever felt dizzy when standing up, don't ignore it. Simple lifestyle adjustments like standing up slowly, staying hydrated, and checking medications that may contribute to low blood pressure can reduce your risk. But the most important step is awareness. Recognizing the warning signs early and taking precautions can help prevent the kind of fall that could change your life in an instant. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 3, hidden blood clots, deep vein thrombosis. Many people think of blood clots as something that only happens in extreme situations, like after surgery or a long hospital stay. But what most don't realize is that blood clots can form quietly in the legs, often with little to no warning. And when they break loose, they can travel to the lungs, causing a sudden and fatal pulmonary embolism. This is why deep vein thrombosis (DVT) is sometimes called a silent killer. It develops slowly but can strike without mercy. Picture someone like Harold, a 76-year-old who enjoys reading on his porch for hours at a time. He doesn't consider himself inactive. He still runs errands, takes short walks, and does light gardening. But one day, after spending an afternoon in his recliner watching television, he noticed some mild swelling in his calf. It wasn't painful, just a little puffy. He figured he must have sat in one position for too long, so he ignored it. Days later, he felt short of breath, but assumed he was just coming down with a cold. What Harold didn't know was that the swelling in his leg was caused by a clot, and when he suddenly collapsed one evening, it was because that clot had traveled to his lungs. He never saw it coming. The scary part about DVT is that it can develop in people who don't consider themselves inactive. Long periods of sitting, whether while watching TV, driving, or even sleeping, can slow circulation in the legs, allowing clots to form. And the symptoms are often easy to miss. A little swelling, slight tenderness, a mild cramp in the calf. None of it seems like an emergency. But if a clot dislodges and moves to the lungs, it can cut off oxygen in seconds, causing sudden collapse or even instant death. Older adults are especially at risk because circulation naturally slows with age, and conditions like diabetes, heart disease, and high blood pressure only make matters worse. Certain medications, including some commonly prescribed for blood pressure or cholesterol, can also affect clotting. And dehydration, which is common among seniors, thickens the blood, making clots even more likely. The combination of these factors turns what seems like a minor issue into a deadly threat. The best way to prevent DVT is to keep moving. If you sit for long periods, stand up and stretch every hour. Flex your feet, move your legs, and drink plenty of water to keep your blood flowing. Compression socks can help, and if you notice persistent swelling, redness, or warmth in your leg, don't ignore it. See a doctor immediately. Catching a clot early can mean the difference between a routine treatment and a life-threatening emergency. Now let's talk about another silent but deadly risk that too many people overlook. Number 4, undetected infections leading to sepsis. One of the most deceptive threats to people over 70 isn't something dramatic like a heart attack or stroke. It's something far more insidious, an infection that seems minor but quietly escalates into a deadly condition called sepsis. Sepsis is the body's extreme reaction to infection, triggering widespread inflammation that can lead to organ failure, shock, and sudden death. What makes it so dangerous is that the symptoms often appear mild at first, leading many seniors to ignore them until it's too late. Take someone like Walter, an 81-year-old who prides himself on rarely needing to see a doctor. One afternoon, he notices that he's urinating more frequently than usual, and there's a slight burning sensation. He figures it's just part of getting older and drinks more water, assuming it'll pass. But over the next few days, he starts feeling fatigued, a little confused, and strangely cold, even though it's warm outside. By the time his family convinces him to go to the hospital, his infection has already spread into his bloodstream. Within hours, his condition worsens, and despite the doctor's best efforts, Walter's organs begin shutting down. What many people don't realize is that common infections, like urinary tract infections, UTIs, pneumonia, or even a small wound on the skin, can rapidly escalate into sepsis, especially in older adults. The immune system weakens with age, making it harder for the body to fight off infections. What starts as a simple UTI or respiratory infection can turn into a full-body emergency if bacteria enter the bloodstream. And once sepsis sets in, time is critical. Every hour without treatment increases the risk of death. The symptoms of early sepsis can be tricky to recognize because they often mimic everyday issues like fatigue, mild fever, confusion, or weakness. Many seniors brush them off as just feeling a little under the weather, not realizing that these subtle signs could be the body's way of signaling a life-threatening infection. If left untreated, sepsis can cause blood pressure to drop dangerously low, shutting down vital organs like the kidneys, liver, and heart. In some cases, it progresses so rapidly that people don't even make it to the hospital in time. So what can you do? The key is to take infections seriously no matter how small they seem. If you have a fever, chills, sudden confusion, or feel weaker than usual, don't ignore it. If a simple infection isn't improving with home care, seek medical attention right away. And if you or a loved one ever experiences symptoms of sepsis such as rapid breathing, extreme fatigue, or a sudden drop in blood pressure, get to a hospital immediately. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 5, medication mismanagement. One of the most underestimated dangers after 70 isn't a disease or an accident. It's something that happens in homes every single day: medication mismanagement. Taking the wrong dose, skipping a pill, or combining medications that don't mix well can trigger life-threatening reactions, leading to sudden cardiac events, strokes, or even fatal internal bleeding. The scary part? Many seniors don't realize they're at risk until a mistake has already been made. Consider someone like Helen, an 82-year-old who has been on blood pressure medication for years. She's careful about taking her pills every morning. But one evening, after struggling with back pain, she takes an over-the-counter pain reliever without thinking twice. The next morning, she feels lightheaded and weak, but assumes she just needs to eat something. Later that day, she collapses. What she didn't know was that the pain reliever she took had a dangerous interaction with her blood thinner, causing internal bleeding that went unnoticed until it was too late. As we age, our bodies process medications differently. The liver and kidneys slow down, meaning drugs stay in the system longer, sometimes building up to toxic levels. Medications that seem harmless in younger years can have stronger effects, and mixing the wrong ones, even over the counter, drugs or herbal supplements, can cause severe, even fatal consequences. Blood thinners, heart medications, and pain relievers are some of the most common culprits. But even something as simple as missing a dose of a heart or diabetes medication can send the body into shock. Another major issue is prescription overload. Many seniors take multiple medications for different conditions, and it's easy for things to get complicated. Some pills need to be taken on an empty stomach, others with food. Some shouldn't be mixed, while others require precise timing. A simple scheduling mistake, like doubling a dose because you forgot whether you already took it, can cause a sudden drop in blood pressure, dangerously low blood sugar, or a fatal heart rhythm. So, how can you protect yourself? First, always keep an updated list of all your medications, including supplements. If you see multiple doctors, make sure each one knows everything you're taking to avoid dangerous interactions. Use a pill organizer or set reminders so you never miss a dose or accidentally take too much. And before starting any new medication, whether it's prescription or over-the-counter, ask your doctor or pharmacist if it's safe to take with your current medications. Your health is too important to leave to chance. Even one small mistake with medication can have devastating consequences. So staying informed and organized can mean the difference between life and death. Now let's move forward. Final thoughts. Now that we've explored these 5 sudden death triggers after 70, take a moment to reflect on which of these risks might apply to you or someone you love. The truth is, most people don't realize just how fragile certain aspects of their health can become with age. And the most dangerous threats are often the ones that go unnoticed until it's too late. But the good news is that awareness is the first step toward prevention. Maybe you've experienced occasional dizziness when standing up but never thought much of it. Or perhaps you've ignored mild swelling in your leg, thinking it was just from sitting too long. It's easy to overlook these signs, but small changes in your daily habits, like standing up, slowly staying hydrated, or making sure you're moving regularly, can make a life-saving difference. And if you're on medication, double-checking dosages and interactions might be one of the simplest yet most powerful things you can do to protect yourself. The goal of this video wasn't to alarm you, but to empower you with knowledge. Because the more you understand these risks, the more control you have over your health. Simple steps like recognizing the warning signs of a silent heart attack, watching for early symptoms of sepsis, or preventing dangerous falls can add years to your life. And remember, staying proactive about your health isn't just about avoiding danger. It's about making sure you can continue enjoying life, spending time with loved ones, and doing the things that make you happy. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.